There is an ongoing effort to address Indigenous-specific discrimination and racism in BC's healthcare system. Discrimination in the provision of healthcare in British Columbia is prohibited under the BC Human Rights Code, which ensures protection for members of certain groups.
However, historically this protection was not always given, and this is especially true for Indigenous peoples in British Columbia. The history of colonization at the hands of the provincial and federal governments has caused ongoing trauma, which still impacts Indigenous people today.
Many of these injustices have been committed in healthcare settings, such as hospitals and medical clinics. This has led to Indigenous people's mistrust of the healthcare system. This mistrust is made worse by instances of racial discrimination, which continue to negatively affect healthcare access and outcomes for Indigenous people.
Every partner in healthcare has an opportunity and a responsibility to create a healthcare system where Indigenous people can receive culturally safe and appropriate care. This includes BC's health regulators and the professionals they regulate. BC's health regulators have been on this journey since 2017, when they signed the Declaration of Commitment to Cultural Safety and Humility in the regulation of health professionals serving First Nations and Aboriginal people in BC. This declaration represents a public commitment to strengthen relationships with Indigenous people and to ensure that culturally safe and humble practices are embedded in day-to-day operations and formal proceedings. In 2020, the In Plain Sight report, an independent investigation into Indigenous-specific discrimination in BC's healthcare system, showed how racism continues to have a devastating effect on the health outcomes of Indigenous people in this province. It made clear there was much more work to be done. This created an impetus for the College of Physicians and Surgeons of BC and the BC College of Nurses and Midwives to accelerate the development of new standards for the healthcare providers we regulate.
The purpose of the new standards is to set clear expectations for how physicians, surgeons, nurses, and midwives must provide culturally safe and anti-racist care for Indigenous people. The standards were developed through an extensive consultation process with Indigenous members of the public who explained what culturally safe care meant to them and shared their experiences. Indigenous health care providers and other health partners also gave us feedback on the draft standards and advised on how implementation barriers could be addressed. The consultation process revealed that healthcare providers currently exist on a wide spectrum in terms of their knowledge and understanding of cultural safety and humility. This series of videos was created in part to support healthcare providers in their journey to learn about cultural safety and anti-racism and to help them apply the new standards. The healthcare providers we regulate are expected to meet these new standards, just as they are expected to meet any other standard. Concerns brought to the college about healthcare providers who may not be meeting the standards will be reviewed on a case-by-case basis.
These standards will be continually reviewed and revised over time based on feedback, particularly from Indigenous people and Indigenous healthcare providers. All individuals have the right to culturally safe care. It is the collective responsibility of all health partners, including regulators and healthcare providers, to ensure that nobody in BC is discriminated against in our healthcare system.